Hi, I'm Bree Garbus. I am one of the attending physician assistants for the Women's Clinic Specialty Equal Access Nights. It is my job to ensure that the physician assistant and medical students who come to clinic are overseeing our patients and providing the standard of medical care that we expect our patients to have.
Hi, my name is Vanessa Ceval and I'm currently the undergraduate Women's Night Coordinator for Equal Access Clinic, specifically the Main Street site. On a typical Women's Night, what patients would do is that they just sign in at the front and they get called in by an undergraduate volunteer. Mainly you just do simple vitals such as height, weight, O2 saturations, and temperature, and then you go into the room where the undergraduate volunteer asks you a couple questions about mental health, your physical health, and kind of what brings you in there today. We call this our intake process. During the intake process, one of the questions that they ask you that's specific to Women's Night is if you're interested in long-active reversible contraception. Long-active reversible contraception includes IUDs, Nexplanon, and Depo shots, which are all offered at our sites. Any referrals that are made through this intake process are then sent to me, and I'm in charge of calling the patients and scheduling them accordingly for these services. After the intake process, the patient just sits in the room for a while and waits for the medical student to come in.
Hi, my name is Emily. I'm a second-year medical student with the University of Florida, and I am also the co-coordinator of Women's Night here at the Equal Access Clinic. So just to give you a brief overview of what the visit looks like after the undergraduate collects your vitals and brings you back to your patient room. Next, a medical student will actually come and see you, and the medical student's responsibility is to collect a more thorough history from you. They're going to talk about your social history, your past medical history, get a more in-depth idea about what's going on for your complaint at that visit. And then they're also going to complete a brief physical exam, and their medical students' physical exam will be more of a listening to your heart, listening to your lungs, maybe an abdominal exam. Once they're done collecting that history and doing the brief physical exam, they're going to go back and talk to one of our attendings. We have very wonderful women's health attendings from all over Gainesville, mostly at the University of Florida, and they will come and speak to the medical student, and they'll kind of discuss what's going on in your case, and together the medical student and the attending will come back into the patient room to see you directly, and together you will talk with the medical student and the physician more and get a better idea about what's going on. The physician will ask you some more questions, do a more thorough physical exam. Once your visit is complete and you have left, me and my co-coordinator are responsible for following up with your lab results, and we will contact you, and then we also are going to be helping patients find other resources on a case-by-case basis.
Hi, I'm Bree Garbus. I'm one of the physician assistant attendings for Women's Night, our specialty clinic for the Equal Access. And my role is once the medical student or PA student sees the patient, they come get me, present the patient, and then I will come in, perform my examination, and we'll come up with a plan that's both equitable and the best medical treatment possible for our patient given their diagnosis and their financial situation. We offer basic gynecologic services starting with annual examination, pap smear, and breast exam. We also can provide basic sexually transmitted infection screening. We can do chlamydia and gonorrhea screening on site here. We can also offer that as a lab test should the patient decide they don't really want to have a pelvic exam performed. So that patient can be given a slip to go off to our local Quest, and that's at no cost to the patient. They can also have blood testing performed for hepatitis B, C, syphilis, and then HIV if that's not done in clinic, which is another service that we provide. Another very requested and needed service is that of birth control. We have multitude of options out there for birth control, and we sit down and discuss with the patient their lifestyle need, what's best for them at the time of life that they're in right now, whether it be a birth control pill, the Depo-Provera injection, which we can provide in clinic at the time of the patient's visit, NuvaRing, the birth control patch, or possibly they're looking for what's called a LARC, which is a long-acting reversible contraceptive, which we can also do for them via an IUD, which is a device that's implanted in the uterus, or a rod that's placed in the arm. So both of those are services that we can do through our clinic, and patients are very happy with the option to have those things. So that is a good handful of the services that we provide in clinic at Women's Night. We are well equipped to handle many, many concerns of the female patient, and we're happy to provide as a great set of care for our patients here at Women's Night.